41. A nurse can delegate discharge teaching to an LPN. True or false? Answer: false. Rationale: discharge teaching requires comprehensive clinical judgment and is within the RN scope, not the LPN's, per NCLEX-PN scope of practice guidelines. 42. The nurse should report unsafe staffing levels to the supervisor. True or false? Answer: true. Rationale: reporting unsafe staffing levels protects patient safety and supports quality care per ANA advocacy and safety standards. 43. A nurse can withhold a patient's medication without a physician's order. True or false? Answer: false. Rationale: withholding medication requires a physician's order or clinical justification, e.g., adverse reaction, as nurses cannot independently alter treatment per ANA standards. 44. The nurse should include the dietitian in the care plan for a patient with malnutrition. True or false? Answer: true. Rationale: dietitians provide expertise in nutritional management, ensuring comprehensive care for malnourished patients, per the Joint Commission interdisciplinary standards. 45. A UAP can assist with ambulation for a patient recovering from surgery. True or false? Answer: true. Rationale: assisting with ambulation is within the UAP scope if trained, with a nurse ensuring patient safety per NCLEX-PN delegation guidelines. 46. The nurse should prioritize a patient with a blood pressure of 200/110 mmHg over a patient with a scheduled dressing change. True or false? Answer: true. Rationale: severe hypertension, 200/110 mmHg, is a medical emergency requiring immediate intervention, prioritizing it over routine tasks per ANA prioritization principles. 47. A nurse can share patient information with a third-party payer without consent. True or false? Answer: false. Rationale: sharing information with third-party payers requires patient consent or legal authorization to comply with HIPAA privacy rules. 48. The nurse should use restraints as the first intervention for a confused patient. True or false? Answer: false. Rationale: restraints are a last resort after non-restrictive interventions, e.g., reorientation, fail to ensure patient safety, per the Joint Commission restraint guidelines. 49. A nurse must maintain patient confidentiality even after the patient's death. True or false? Answer: true. Rationale: patient confidentiality extends beyond death, protecting personal health information, per HIPAA and ANA ethical standards. 50. The nurse should delegate the administration of 4 push medications to an LPN. True or false? Answer: false. Rationale: 4 push medication administration requires advanced training and is typically within the RN scope, not the LPN's, per NCLEX-PN scope of practice guidelines. 51. The nurse should ensure a patient's room is free of clutter to prevent falls. True or false? Answer: true. Rationale: a clutter-free environment reduces fall risks, promoting patient safety, per the Joint Commission safety standards. 52. A nurse can delegate the development of a care plan to a UAP. True or false? Answer: false. Rationale: developing care plans requires clinical judgment and is within the RN scope, not the UAP's, per NCLEX-PN delegation guidelines. 53. The nurse should report a colleague's impaired practice to the supervisor. True or false? Answer: true. Rationale: reporting impaired practice protects patient safety and upholds professional standards per ANA Code of Ethics and NCLEX-PN guidelines. 54. A nurse can accept a verbal consent for a procedure over the phone. True or false? Answer: true. Rationale: verbal consent over the phone is acceptable in emergencies or with documentation, but written consent is preferred, per the Joint Commission standards. 55. A UAP can assist with collecting a clean catch urine sample. True or false? Answer: true. Rationale: collecting a clean catch urine sample is within the UAP scope if trained, with a nurse ensuring proper technique, per NCLEX-PN delegation guidelines. 56. The nurse should prioritize a patient with a new seizure over a patient with a scheduled medication. True or false? Answer: true. Rationale: A new seizure is a medical emergency requiring immediate intervention, prioritizing it over routine medication, per ANA prioritization principles. 57. A nurse can administer a medication without a physician's order in an emergency. True or false? Answer: false rationale. Medications require a physician's order, except in emergencies with standing protocols, e.g., Code Blue, per ANA standards of practice. 58. The nurse should include the pharmacist in the care plan for a patient with multiple medications. True or false? Answer: true rationale. Pharmacists provide expertise in medication management, reducing errors and optimizing therapy, per the Joint Commission Interdisciplinary Standards. 59. A UAP can perform a head-to-toe assessment. True or false? Answer: false rationale. Head-to-toe assessments require clinical judgment and are within the RN scope, not the UAP's, per NCLEX-PN scope of practice guidelines. 60. The nurse should ensure a patient's advance directive is included in the medical record. True or false? Answer: true rationale. Including advance directives in the medical record ensures respect for patient wishes and guides care, per the Joint Commission standards. 61. A nurse can delegate the administration of oral medications to a UAP. True or false? Answer: false rationale. Administering oral medications is outside the UAP scope, reserved for licensed nurses to ensure safety, per NCLEX-PN delegation guidelines. 62. The nurse should report a patient's fall to the risk management team. True or false? Answer: true rationale. Reporting falls to risk management supports quality improvement and prevents future incidents, per the Joint Commission safety protocols. 63. A nurse can ignore a patient's request for a second opinion. True or false? Answer: false rationale. Patients have the right to seek a second opinion, and nurses should advocate for this right, per ANA ethical standards. 64. The nurse should prioritize a patient with a pulse oximetry reading of 88% over a patient with a scheduled diagnostic test. True or false? Answer: true rationale. A pulse oximetry reading of 88% indicates hypoxemia, requiring immediate intervention over routine tests, per ANA prioritization principles. 65. A UAP can assist with bathing a patient with stable vital signs. True or false? Answer: true rationale. Bathing stable patients is within the UAP scope, with the nurse ensuring safety and supervision, per NCLEX-PN delegation guidelines. 66. The nurse should verify a patient's allergies before administering medications. True or false? Answer: true rationale. Verifying allergies prevents adverse reactions and ensures patient safety, per the Joint Commission medication safety standards. 67. A nurse can delegate the adjustment of a patient's 4 flow rate to an LPN. True or false? Answer: true rationale. Adjusting 4 flow rates is within the LPN scope in many states, with RN supervision, per NCLEX-PN scope of practice guidelines. 68. A nurse can refuse to float to another unit if untrained for that specialty. True or false? Answer: true rationale. Nurses can refuse to float to unfamiliar units if untrained, as it protects patient safety and aligns with ANA competency standards. 69. A UAP can assist with applying a warm compress to a patient's leg. True or false? Answer: true rationale. Applying warm compresses is within the UAP scope if trained, with the nurse ensuring proper technique, per NCLEX-PN delegation guidelines. 70. The nurse should include the occupational therapist in the care plan for a patient with limited hand dexterity. True or false? Answer: true rationale. Occupational therapists address functional limitations, ensuring comprehensive care for patients with dexterity issues, per the Joint Commission standards. 71. A nurse can administer a medication after the expiration date if no alternative is available. True or false? Answer: false rationale. Expired medications may be ineffective or unsafe and should not be administered, per the Joint Commission medication safety standards. 72. The nurse should ensure a patient's call light is within reach to promote safety. True or false? Answer: true rationale. Keeping the call light accessible allows patients to request help, reducing fall risks and promoting safety, per the Joint Commission standards. 73. A UAP can assist with transferring a patient from bed to wheelchair. True or false? Answer: true. Rationale: transferring patients is within the UAP's scope if trained, with the nurse ensuring safety per NCLEX-PN delegation guidelines. 74. The nurse should prioritize a patient with a new arrhythmia over a patient with a scheduled dressing change. True or false? Answer: true. Rationale: a new arrhythmia is potentially life-threatening, requiring immediate assessment over routine tasks per ANA prioritization principles. 75. A nurse can share patient information with a clergy member without consent. True or false? Answer: false. Rationale: sharing patient information with clergy requires patient consent to comply with HIPAA privacy regulations. 76. The nurse should document a patient's refusal of treatment in the medical record. True or false? Answer: true. Rationale: documenting treatment refusal protects patient autonomy and provides legal evidence of informed decision-making per the Joint Commission standards. 77. A UAP can assist with monitoring a patient's intake and output. True or false? Answer: true. Rationale: monitoring intake and output is within the UAP's scope if trained, with the nurse interpreting data per NCLEX-PN delegation guidelines. 78. The nurse should report a malfunctioning medical device to the biomedical department. True or false? Answer: true. Rationale: reporting malfunctioning devices ensures patient safety and supports equipment maintenance per the Joint Commission safety standards. 79. A nurse can delegate the administration of a blood transfusion to an LPN. True or false? Answer: true. Rationale: LPNs can administer blood transfusions in many states under RN supervision, per NCLEX-PN scope of practice guidelines. 80. The nurse should prioritize a patient with a respiratory rate of 32 breaths/min over a patient with a scheduled medication. True or false? Answer: true. Rationale: a respiratory rate of 32 breaths/min indicates respiratory distress, requiring immediate intervention over routine medication, per ANA prioritization principles.